Well, good morning, and thank you all again for joining us today for a briefing on the ABCs of federal early learning and care funding. My name is Sarah Rubenfield, and I serve as the Director of Government Affairs for the First 5 Years Fund, also known as FFYF. At FFYF, we work to ensure all children from birth through age 5 have equitable access to affordable, high-quality early care and education that supports healthy development and helps our youngest learners achieve their full potential in school and life. Over the years, we've been so pleased to see a growing understanding of the critical role high-quality early learning and care plays in laying the foundation for school readiness, improved education outcomes and graduation rates, while also providing key social and emotional skills. There's also been a growing recognition that too many families struggle to find and afford high-quality early learning and care options that meet their needs. While the early educators and childcare programs they rely on have long faced their own challenges of low wages and slim margins, and this was certainly true before the pandemic and is even more of an issue today. At the same time, over the past year, the coronavirus pandemic has reinforced for millions of Americans the indispensable role of childcare and early learning in supporting a parent's ability to go to work and our nation's economic recovery. Demonstrated by growing broad bipartisan support, we are grateful that members of Congress have recognized the importance of federal early childhood education programs and the critical foundation federal funding providers for our nation's early learning and care system. In recent years, Congress has passed funding increases for core early education or childhood education programs, including Head Start and Early Head Start Child Care Partnerships, Preschool Development Grants Birth through 5, and the Child Care and Development Block Grant Program. And today we will be discussing these key early learning and care programs, their funding streams, and what each of these programs means for children and families across the country, and opportunities for congressional action. We're also going to answer any questions you might have, so please feel free to ask those through the Q&A tool as part of this Zoom. And as you think of them, we'll do our best, or as you think of them, and we'll do our best to answer as many questions as possible at the end of today's briefing. So we're very excited to be joined today by a great group of speakers. And I would like to introduce our first speaker, Ann Hedgepeth, who will be discussing the critical yet distinctly different roles of the recent child care relief funding and annual appropriations funding. Ann is the Senior Director of Federal and State Government Affairs with Child Care Aware of America, where she manages the organization's public policy work, as well as supports the advocacy and awareness efforts of child care resource and referral agencies and other stakeholders across the country. Thank you so much for joining us today, Ann.
Thanks, Sarah. I'm so glad to be here today and to join this incredible slate of panelists who will be speaking during this briefing. I'm Ann Hedgepeth, Child Care Aware of America's Senior Director of Federal and State Government Affairs. Child Care Aware of America works with more than 400 state and local child care resource and referral agencies nationwide. To achieve our mission, we lead projects that increase the quality and availability of child care. We undertake research and we advocate for child care policies that positively impact the lives of children and families. And I want to start our conversation today by doing some level setting. I think that we all know that long before COVID-19, the US childcare system was facing challenges. Child Care Aware of America's annual report, which looks at the high price of childcare, has consistently found that the childcare system is fragmented in many ways. Each state has its own set of policies, and funding comes from different sources with different requirements. That it can be inequitable, that children of color and children from low-income families are less likely to attend high-quality childcare programs, that the childcare system can definitely be inaccessible. For many families, high-quality childcare is not an option, and there are not enough childcare providers to meet the demand. Providers are also leaving the field in record numbers. This particularly affects families of color, families living in rural areas, and children with special needs. And we also know that the childcare system is underfunded. The US spends less than 0.5% of our GDP on childcare, far less than other industrialized countries. And this results in serving just a fraction of eligible children, less than 20% of eligible families. And again, these challenges predate the pandemic. The pandemic, though, has layered on top of this system some additional vulnerabilities, which I want to speak to briefly. Child Care of America found that about 13% of centers and 13% of family child care homes were closed as of December 2020. In our fall 2020 report, Picking Up the Pieces, we noted that family child care homes had a higher open rate than centers during the peak of the pandemic, but some of these differences are beginning to disappear by the end of 2020. Some individual states are also doing these types of analyses themselves, like the California Child Care Resource and Referral Network, which found that total family child care home licenses are down 14%, and the total center licenses are down 33%. The pandemic has had a significant impact on the supply of childcare. To rebuild what has been lost, the recent investment of relief funds from the CARES Act, the December Relief Bill, and the American Rescue Plan Act will be critical. Those funds are going to go to stabilizing the industry, supporting programs and providers who lost money, helping to replenish lost supply, and investing in families who may be facing economic insecurity during our recovery. But to make good on a promise that for so many childcare and early learning champions in Congress has been in development for years, for example, with things like the reauthorization of CCDBG in 2014 and the increase in funding in FY 2018, annual appropriations matter. Annual appropriations allow for ongoing investments in quality, in improvements to the underlying structure that connects families with childcare, in long-term assurances that families will have a subsidy that will allow them to access care, for continued work to ensure that care is available in areas that may not currently have supply, the childcare deserts that we know exist across the country, and that families can choose the type of care that suits their needs, including family childcare. Relief funds will get us back on track. Annual appropriations help us lay the track up ahead for where we are going. And I also want to note, and I think you'll hear this in the remarks from our panelists today, this means focusing on all of the programs that contribute to early learning and child development in communities across the country. So that means investing in childcare through the Child Care and Development Block Grant so that states can support high quality childcare and we can reach families with a meaningful subsidy while supporting and compensating our childcare workforce. That also means investing in Head Start and early Head Start. These programs have risen to the challenge of the pandemic, even as they face additional operational costs, facility demands, and compounded childhood trauma and child welfare needs. Important funding needs remain for these programs, and increased investment in the foundation of these programs would ensure communities can fully leverage Head Start to support children and families. And this means investing in Preschool Development Grant Birth through 5 programs, which have been instrumental in helping states plan for and execute on their vision for childcare and early learning. So now I'm going to hand things back over to keep our program moving and dig in on some of these topics.
Thank you so much, Anne. And now I would like to introduce Dr. Sarah Vanover, who currently serves as Director of the Division of Child Care for the Commonwealth of Kentucky, who will be discussing the critical role of the Federal Child Care and Development Block Grant Program, often referred to as CCDBG. For over 22 years, Dr. Vanover has been working in the field of early childhood as a classroom teacher, school readiness coach, a program director, and a college professor of early childhood education. Most recently, she has focused her work and research on assessing quality early childhood programs for health and safety requirements and supporting school readiness skills. Thank you for joining us today, Dr. Vanover.
Thank you so much. I appreciate the introduction and the chance to speak with you all today. As Sarah said, I am the director for the Division of Child Care in Kentucky, and that also means that I'm the state administrator for our Child Care and Development Block Grant funds, which means that I am the steward of those funds throughout the state to support all of our child care programs, both center-based care and family child care homes. Our child care funds that we receive from the federal government serve many purposes. They affect families who need subsidy, and cannot pay for childcare without support. That's the major stream of funding that we use those for. But they also go to help with background checks for childcare employees, to cover the cost of monitoring facilities to make sure that our children are in healthy and safe environments, to help with professional development and technical assistance in the centers to help train childcare providers to be the best at their job and support them when they have challenging situations. And also as a part of our quality rating system, they help centers achieve higher levels of quality in order to make the best possible environment for our childcare programs. So those funds are essential. And of course, our state provides a match in order to receive those federal funds, but the federal funds are by far the largest stream of income that we receive. Now I can say in Kentucky and in all states, when we receive that big portion that goes towards subsidy, in Kentucky prior to the pandemic, we had slots for 165,314 children in childcare, and we had up to about 32,000 children that received subsidy. So about 16 to 17% of the children in childcare receive subsidy, which is accurate with national data, where up to about 20% of children receive a lot of that funding. And so the other 80% of those centers predominantly work on parent fees, and they use those parent fees to do everything within their center. That puts a high burden on the families, and it also limits the income of the center dramatically, so that salaries and expenses are not as high as they could be in order to provide the highest quality of care. When we look at how we use those funds, many of the centers that get that 20% of funding are within 30 to 40% of the centers throughout the state. The others may charge more than the subsidy allowance will allow. They have an overage fee, and our subsidy families may not be able to provide that overage. So in those centers that do not receive a high amount of subsidy, or maybe they only receive several children who get subsidy, there's virtually no funding. They get support with background checks, they get support with professional development, but they do not get the support that public schools might throughout the state. When we sit down and we allocate these funds, we make hard decisions on how we can distribute funding to all centers. For example, quality rating systems throughout all the United States give an incentive to centers who participate, and the higher quality the center gets, the more of an incentive they may receive. However, this may be only an annual incentive. It may be a large amount at one time that allows a center to purchase a piece of playground equipment or to replace an appliance that's essential, but it does not offset the large cost that is needed to run a center. Therefore, in our state and many other states, there are areas of the state who have limited access to childcare. In 2014, when the Child Care and Development Block Grant was reauthorized, there was a huge focus on making sure that all families had access to quality childcare. And throughout all the states, we're trying to do this. In Kentucky, we have 120 counties. 65 of those counties are childcare deserts. That means that there is not enough childcare for the children that live within those counties. And what we know when there are childcare deserts and there's not enough quality childcare that is regulated with background checks and inspections is that many of these families go and find unregulated care. Parents are leaving children with providers that we don't know about their background, that we don't know if their home is safe. And so as each state strives to increase the amount of childcare throughout the state and make sure that there are quality regulated environments where children can be safe, we're encouraging centers to open up, but we may not have the funding that we need to help the center sustain once it's opened. So there are a lot of challenges to still overcome, and access is a huge issue. Anne mentioned the fact that access can also be an issue of rural versus urban. In Kentucky, we have a lot of rural areas, particularly through the Appalachian Mountains in eastern Kentucky. And those are areas where it's very hard to sustain childcare programs. And as we strive to help families open childcare homes that may be more successful in smaller environments, we still have to find ways to support those programs and make sure that not only can we monitor them, but we give them the resources and the supports that they need to stay open, and to make sure that they can support the children that come to them. And we have more and more children that are looking for these environments, which means that we have more and more parents that need a safe place to put their children in order to go to work and support their families. Childcare has a dual focus. We want to make sure that children are in a safe place throughout the day and that they're getting the best education to be ready for school and the best social and emotional growth. But we also want to make sure that families can go to work and that they don't worry while they're at work about whether or not their children are safe. And this makes families be able to be successful. When you have quality and safe childcare, you don't leave work. And as a parent myself, I can say that when my kids are in a safe environment, I can focus on my job during the day and I can be a contributing part of the environment and to my work environment. And so those are things that, as we use these childcare block grant funds within our states, that the state administrators have to think about. Do all families have access? Do the families who need subsidy receive it? And how do we support all of the other centers that don't get a stream of subsidy? And so those are questions that, as we move forward, particularly after the pandemic, as the economy needs stimulation, those are questions that are placed on us that we have to consider. How do we meet these needs and support them? Thank you.
Thank you so much, Dr. Vanover. We really appreciate that terrific overview. And now I would like to introduce Ms. LaTanya Wynn Hall, Regional Executive Director for Lutheran Services in Florida, Duval Head Start, to discuss the importance of the Head Start and Early Head Start. Ms. Wynn Hall has been with Head Start for over 16 years of her 28-year career and currently oversees an early childhood education program that serves 1,400 children ages 6 weeks to 5 years old. Thank you so much for joining us here today, Ms. Wynn Hall.
Thank you. So as mentioned, yes, I am LaTanya Wynn Hall. I am the proud Executive Director of Lutheran Services Florida Duval in Jacksonville, Florida, but I'm also a member of the Office of Head Start National Family. So I first want to thank Congress because 56 years ago, they passed the Head Start Act, and that made it law. And so for 56 years, the Office of Head Start has served over 1 million children annually. And these children are our most vulnerable children. And I say vulnerable because they are from low-income families and they live below the poverty level. So we know this population has not received the resources that these children need to be ready for kindergarten and to prepare them for life. So Head Start not only serves children, but also pregnant women. Head Start provides public and nonprofit organizations and tribal communities. So the partnerships that we have with our school districts, with our child care providers, with our family child care homes, that local collaboration truly makes this a valuable program for our communities. As I mentioned, 90% of the enrolled Head Start children are below poverty level, and the remaining 10% have to have a documented special need or disability. So when we say school readiness, we are saying the comprehensive services that Head Start provides gets those children ready that on day one of kindergarten, they are ready to sit next to that child from a rich or wealthy family who received the resources that they are able to compete and continue their education. It is not just educational, we provide mental health. And that has truly been, even prior of COVID, and all families are traumatized now. Every single one of us on this Zoom and all families are traumatized. But before that, we had children that had experienced trauma in their first 5 years of life. And so the mental health services that Head Start provides enables that intervention for children to be able to process and work through whatever issues came from that trauma. We also provide dental. And the story that I like to tell is in my first year, and as you said, 28 years ago, there was a 2-year-old who could not speak correctly. And it wasn't because they had developmental delays, it was because they had bottle mouth, meaning they had sucked on a bottle for the first 2 years of their life and it decayed their teeth. So those are the kind of comprehensive additional services that Head Start provides. It also provides nutritional services. The 2.5 meals that our children receive, unfortunately, might be the only meal that they receive during the day. Again, when the pandemic hit, Head Start went into action to ensure that those children were still receiving those nutritional meals, even though the brick and mortar was closed. Also, parent engagement. We are teaching our parents how important it is to be their child's first teacher. So the intervention that Head Start provides is we are hoping that we have children that are success by 6 and great by 8. And I say that because of that 3rd grade assessment where they are determining if a child is going to graduate from high school. So there is a preschool to prison pipeline. And people don't want to, but there is. There are children who are being expelled from preschool. And you say, what can a 1, 2, 3, 4, 5-year-old do to be expelled? They are tearing up classrooms. They are being a danger to themselves, to other children, and to teachers. But Head Start has a no expulsion. We provide whatever additional services that that child and that family might need to prevent that. So let's get to funding. The funding is so important because the federal funding helps to support and supplement the local and state funding that we receive. So Head Start receives a base grant, but then they also help a cost of living adjustment for COLA for staff, and we also have quality improvement. The need for funding is, even with all of the funding that we receive, we still are only serving 36% of eligible Head Start children ages 3 to 5. We are only serving 11% of early Head Start children who are 6-week to 3-year-old. Yes, we still need funding. So this funding comes through federal appropriations. You know, it goes through the Administration of Children and Families and to the Office of Head Start. And what that allows us is for Head Start programs to create these programs and partnerships. It allows us to provide training and technical assistance to our staff. It allows research and evaluation. It allows monitoring support, program support, and transitional support. So like I said, it's a supplement and support to our early learning committee. And I would like to share that our new Office of Head Start Director, Dr. Futrell, she is a former Head Start child. She is a Head Start alumni. Guess what? Head Start works. And we are so happy that she is the example for that. And then we go into the corona pandemic. Wow. Unplanned, unprecedented. But do you know Head Start and early Head Start did not miss a beat? Do you know with the financial assistance that you all provided, it provided us to be able to do the financial and operational hurdles that we needed to jump over to continue to provide services. Those services, we went to virtual. Who thought that Head Start could virtually do anything? But we did. So with that, we had to retool, we had to reset. We went to virtual learning until we could get the PPE, which that funding allowed, the CARES funding, that we could ensure that our staff would be safe and that our children would be safe to return. I'm so happy with Lutheran Services Florida. We were able to provide families during the summer, doing that when we provided virtual services, food distribution. And it just wasn't Lutheran Services Florida, it was every program in the United States, providing food, providing essentials. Oh my goodness, I saw I have 1 minute. Let me wrap this up. I told them I could go on and on. But we were able to do that. We were able to provide iPads for children who did not have technology. So those are the things. Please know that critical funding for PPE, for facilities, for technology, for software workforce, for extended duration for the hours during the day. That is what early learning Head Start programs were able to provide. So with that being said, I just want to say thank you from our nation's most vulnerable children. And on behalf of the Office of Head Start and all of the grantees across the nation, keep doing what you're doing, because we help with that economic recovery of our nation. Thank you.
Thank you so much, Ms. Quinn Hall. That was just terrific. What a great look into the Head Start and Early Head Start program. We really appreciate it. And finally, it's a pleasure to introduce Dr. Barbara Cooper, Secretary of the Alabama Department of Early Childhood Education, to discuss the importance of the Preschool Development Grant Birth through 5 program and the critical role it plays in supporting state early learning systems. Secretary Cooper has served the Alabama Department of Early Childhood Education since 2018, helping to administer the nationally recognized high-quality first-class pre-K program and other birth to age 8 programs, including the first teacher home visiting program. Secretary, thank you so much for joining us here today.
Thank you so much for this opportunity to be a part of this prestigious panel. The Preschool Development Grant Birth to 5 has been instrumental in supporting Alabama's efforts to address both quality early childhood care and education needs and early learning initiatives. Our vision for this grant is that all Alabama children are healthy and emotionally ready to enter kindergarten, particularly children from families with low income or from disadvantaged backgrounds, and that strong supports are provided to assist our families in being able to make those informed choices as their child's first teacher. When putting this vision into action, we were able to conduct a statewide needs assessment to determine the early learning needs for families and children. These efforts, funded by PDG B-5, led to the development of the Alabama Connections for Early Care and Education Strategic Plan, focusing our efforts on 4 statewide goals: access and affordability, family partnerships and supports, well-prepared and well-supported workforce, and quality and accountability. The implementation and success of these 4 goals has been guided and very closely monitored by our steering committee, which consists of state leaders, child care professionals, and other stakeholders who have a vested interest in children. They work together to collaborate on creating and supporting a cohesive system for quality early learning and care. Our grant vision aligns and builds upon Governor Ivey's Strong Start, Strong Finish education initiative, which has been really focused on integrating Alabama's early learning and care, K-12 education, and workforce development efforts into a seamless education to workforce continuum for all Alabamans. Alabama's first-class pre-K program is nationally recognized and serves as a bridge that allows us to build a strong birth to age 8 continuum. As a state, we are using PDG B-5 funds to focus on closing the achievement gap beginning prenatally. The PDG B-5 grant has provided resources across our state by providing that much needed professional development for early care and education professionals, increasing coaching and information sharing to improve our parents' knowledge about choice, providing funding to address pay parity for early care professionals. We've also been able to use trauma-informed interventions, which have been critical with this pandemic, to support children and families with mental health challenges. We've been able to improve early interventions for children experiencing developmental delays and behavioral challenges. We are able to support and strengthen our child care programs through the Alabama Quality Rating and Improvement System, which is undergoing an entire rehaul. We've been able to expand access to high quality pre-K, particularly in those collaborative classrooms that serve our children who have special needs alongside their peers. Barriers such as transportation, broadband access, and creative pathways for education are being addressed through specific PDG B-5 work groups across our great state. Work groups are actively working on strategies to address specific areas of needs. We're now blending and braiding funds for quality childcare, developing a system to identify unduplicated counts for children on wait lists who are enrolled in multiple systems. We're able to partner with local business communities to broaden funding sources and supports, and addressing those barriers for our child care centers pursuing licensure. We've been able to increase our family knowledge and choice about services and supports for their young children. We're working to design and communicate more clear pathways from education and training to high demand early care and education jobs. To better address and understand these barriers, our department has taken a very active approach in collaborating with key leaders across the state to provide much needed equity training. This has strengthened our systems of developing policies, practices, and protocols that achieve more equitable outcomes for all children and families. As one of our core building blocks for racially equitable work, we are systematically applying a structural lens for understanding how racial inequities are produced and actually perpetuated. We're actively addressing other inequities such as infant mortality rates, early literacy, food insecurity, and racial and ethnic disparities. Alabama has committed for a long time to investing in our youngest learners through our first-class pre-K program. This was made possible by continuous gubernatorial and bipartisan legislative commitment to invest in early childhood education. As we all know too well, the pandemic has laid bare the need for prioritizing this investment and has catapulted birth to 5 early learning and childcare to the top of our policy agenda. The PDG B-5 grant has strengthened Alabama's 7 key beliefs around investing early. Number 1, we know high quality early education environments transform children. We know early education places children on a trajectory for later school success. We know the workforce of the future is today's young children and infants. We know young children learn best by discovering, playing, and collaborating in high quality learning environments. We all know quality teachers make a difference. We know investing early in an economic plan that gives every child a fair shot at the American dream matters. We all know it's worth the effort to make a national investment in early education. As we also know, in the United States, 70% of mothers with children under 18 are in the workforce, compared to just 11% in 1960. Yet there has been no significant shift in educational policy and funding to address the need for childcare. The PDG B-5 funding is creating a much needed shift and a pathway for states to prioritize building systems that provide high quality early care and education for all children. We have been honored to have an opportunity to use this funding to support our efforts in Alabama. Thank you for this opportunity to speak with you today about the importance of this funding to allow us to continue to build high quality early care and education for all children.
Thank you so much, Secretary Cooper, for that insight on some of the critical systems building work that's happening in Alabama. We really appreciate it. Now, before we turn to questions, I just want to thank all of our panelists again for providing such helpful overviews of the various federal early learning and care programs. As you heard from all of the panelists, federal funding for all of these programs provided through the annual discretionary appropriations process creates the critical foundation upon which all of these programs sit and is what makes it possible for these programs to serve millions of children and families. So as the FY22 appropriation process gets underway, we would ask lawmakers to continue to please show their support for funding for these critical federal early learning programs by joining their colleagues and signing onto the various member-led appropriations letters. We are always so grateful for the strong bipartisan support shown each year through these letters, and we hope you will please consider signing again this year. As with the past, there is a different letter, and in some cases, multiple letters in support of each of the programs, the CCDBG program, Head Start and Early Head Start, and the PDG Birth through 5 program. And so we will be providing a link to the various member-led letters in the chat, and we will be sure to follow up with additional information. And again, we greatly appreciate your support for this critical federal funding. And so now, as we turn to questions, I'd like to remind everyone that if you do have a question, please feel free to put it in the Q&A. And I will go ahead and start with the first question for any of our panelists to answer to kind of kick things off. So I will ask first, as Congress continues to demonstrate strong bipartisan support for early learning and care programs, as demonstrated through recent funding increases and investments, what have those federal investments meant for the various programs that each of you run or operate in your state, and what needs still exist? And maybe perhaps you can just give one or two examples of what an increase in federal funding has meant for those programs and the children and families that you serve. And I'm not sure if who would like to go first.
I can do that, Sarah. So
Thank you.
The two largest flaws that we have in the child care system throughout the U.S. is that our child care providers are egregiously underpaid and that our parents have to pay such a large amount for child care. When I had an infant and toddler at the same time, I paid $400 more a month in child care than I did on my mortgage. And many families cannot absorb that burden. The new influx of funding that we have for the next 3 years, we are able to encourage programs to pay their providers more, to make sure that they are not paying minimum wage to child care providers who are doing such an essential and important job. We also can help offset the cost of child care so that families are not just under a huge burden when they have one or even two children in child care at the same time. This is going to mean a world of difference for the sustainability of child care. Now, for me as a state administrator, I am so grateful for the new funds that we've received, and we're trying to find the best way to support programs and distribute these funds so that salaries go up and that families can afford quality child care. The only thing that worries me is what happens when these new funds run out. You know, how will child care providers have to take pay cuts, or will they be laid off when centers can't pay the increased salaries that we've been able to develop over these next 3 years? Or will families that had, you know, a cost reduction in childcare, when that cost goes back up, will they have to withdraw their children from childcare and leave the workforce? My favorite thing to say about childcare is that it is the industry that supports every other industry. So as our families put their children in quality childcare and they go out and contribute to the workforce as well, at the end of 3 years, will they have to withdraw from the workforce? Will our providers stop making a livable salary and have to leave their positions? Those are the questions that are coming up. But right now, for the next 3 years, I'm so excited that we have the opportunity with these funds to help our providers make a wage that is closer to what they deserve. And we have a way to offset the cost for families. And I hope we have a way to continue those efforts in the future.
And so I would just say two quick things for Head Start. One, we need more funding to serve more children. As I mentioned before, we are only serving 36% and 11%. But then also, Head Start is requiring that at least 50% of our staff have bachelor degrees. So in order to get staff with bachelor degrees, you have to pay them bachelor degree salary. So because this is quality preschool services. And so I would say those are the two top things. It's more funding to serve more children, and then more funding to ensure that we can continue to get high quality staff who are now credentialed with bachelor's and now master's degrees.
And I would just add to that as well. Certainly pay parity is something that we know is absolutely critical for our childcare workforce. We've been able to do some really great things with our pre-K program, and we have pay parity for our pre-K teachers. And in our PDG B-5 Birth to 5 Foundation sites, we're also working with those sites to achieve pay parity. But we recognize that when those funds are gone, we could possibly be right back to where we started. So we need this extra funding so that we can fully invest in the same ways that in many places we've invested in universal pre-K, so that our childcare also reap these benefits, because we know that high quality programs come with high quality teachers and that investment in our teachers.
Thank you all so much. I think that certainly raises a really, really important point. And, just to kind of help give context for some that are maybe watching, I think the average provider makes about $11 or $12 an hour. Many of them receive public assistance themselves. So just to sort of help quantify what sort of range that you all are talking about. But thank you for that. Now, the next question I wanted to ask was, as we heard today, there are obviously a variety of federal programs that support young children and families. And oftentimes you hear the terminology mixed delivery system. But, I kind of wanted to ask if the panelists could sort of elaborate a little bit more on what we mean by mixed delivery system for early learning and care. Why is it important, and how do these programs work together?
In Alabama, we certainly use and build upon our mixed delivery system. And with our PDG B-5 funds, we've really tried to focus our first 5 foundation sites to go across all of the delivery systems, because we recognize that when we have demonstration sites in all delivery systems, then we have places and models that we can point others towards. Our pre-K programs are also across all mixed delivery systems. So again, this is where we're trying to build. We recognize that, for instance, we can't just be in our public schools. We have to be in our faith-based and our universities and our military installations. All of these places have to become a comprehensive part of the solution. And as we do outreach and try to get more of our centers to apply for our pre-K funding, we're being very intentional about making sure that everyone understands that the mixed delivery system has to be addressed across all continuums, and we have to be building upon the quality in all of those areas.
Yes, and in Head Start, Head Start has a 80-20. So we get reimbursed for 80% of the services, and we are expected to get 20% non-federal match share in kind. And so we have to, with voluntary pre-K, with our child care food programs, and with other funding. I mean, we are always soliciting grants and cash, because we need to, match that 20% because of the 80% that we receive from the Office of Head Start. So that is imperative that we have multi-funding in order to serve more children, and again, to honor our contract.
Of course, childcare is predominantly a private industry. And so, in Kentucky, all of our individual centers and our individual family childcare homes are independent businesses with independent business owners. But those partnerships can still be essential in a mixed delivery model. For example, in Kentucky, our state preschool program is 3 hours a day. And many working families cannot just utilize 3 hours of care. Our childcare programs don't have the resources that public school preschool does, particularly when it comes to working with children with disabilities. And if you're talking about diversity and how to support a diverse early childhood field, you can't leave out children with disabilities. So a lot of partnerships can include an independent child care program partnering with public school preschool to provide wraparound care, but also that the public school preschool can offer supports to our children with disabilities and help child care providers in that arena that they might not be as deeply trained. The same thing can happen with Head Start. If a Head Start program is fully funded for half day, but we have families that still meet the federal poverty guidelines but are working, then child care program support can come in and partner with the Head Start for full day child care services. Now, of course, that also means that our child care programs have to meet those Head Start standards. Then they have to have those degrees and that workforce requirement. And so there's additional support that's needed, but blending some of those programs can provide families the support that they need, or provide our at-risk groups like children with disabilities with the additional support that they wouldn't be able to find just in childcare.
And I think another theme that's showing up in all of the great remarks from panelists is how important it's family engagement and parental choice is as a part of our child care and early learning system. And so all of these different options in a mixed delivery system, be it because of the needs of individual children, the needs of families, their schedules, maybe they work non-standard hours, or because of a variety of programs that would meet all of the different child development goals that we have in our communities, these things come together. And in the best case scenario, with the investment needed, where we're reaching eligible families and supporting programs, families would be able to engage and make choices about what fits their needs. And I think that's the vision, that where we want to go, and why underlying the foundational funding of annual appropriations can make a difference for states to then deliberately create these systems to meet these kinds of needs.
Yeah, thank you. I think that's a great point. I always say there's certainly no more personal choice a parent has to make as to where they're to leave their child and who to leave their child with when they have to go back to work. So the parental choice is really key, particularly with what fits with parents' schedules as well, and access and availability. So we do have one question in the Q&A about additional information after the briefing and resources. We will certainly be following up with congressional offices. We are recording this briefing, and so we will provide a link as well as information on the various appropriations member-led letters that we would encourage your bosses to join in signing. But if others have any questions, please feel free to put them in the Q&A. We are happy to answer your questions. In the meantime, I'll go ahead and ask another question. While we know there is tremendous interest and progress being made at the state and local level in regards to early learning and care, what role does the federal government play in supporting these efforts? And how do federal investments support state and local efforts in congressional districts across the country?
One thing I want to mention, Sarah, as we get started, and I'm sure that folks have a bunch of great examples, is I think that states are making some really interesting and innovative decisions about how to fund childcare and early learning that are really showing us the way forward for the future of the system. Some of that's been born out of the necessity of the crisis we've been in the pandemic. So states have been re-envisioning ways to do payment, thinking about how we can secure or make the system less vulnerable by supporting programs by payment through enrollment or contracts. We've seen states really address head-on the unaffordability of childcare by reducing things like co-payments for families, especially in an economic downturn. I'm also thinking about the ways in which states have created some, they've been investing in data and technology solutions, so making platforms available that better connect families with care. Some of these things happened because the pandemic brought on a crisis, but some of those things were a follow-on from the amazing planning that states have been able to do. And that planning has demonstrated where annual increases in funding, knowing there'll be stable funding to build the future of childcare and early learning, can be really critical. And I'm sure many of the panelists have some experiences there. But when I think about how the federal funding flows through and can really spark these important investments and changes and improvements in childcare and early learning, I think that we've seen a lot of really interesting things happen over the past few years, and look forward to hearing more from my colleagues.
So yes, so federal funding, again, it truly supplements and supports Head Start. And it is predominantly the funding that we receive, but that local and state truly helps to, one, make us a part of the communities that we are a part of. I mean, we receive local grants to assist us with that additional funding that is required. We have partnerships with our Early Learning Coalition, you know, for state funding. So it just does things from grants to be able to purchase iPads for children who didn't have technology, able to purchase playgrounds, you know, when we move into a new facility. During COVID, essentials, we were able to give out diapers and wipes. When we asked families, what do you need? Diapers, wipes, feminine products. You know, those were the essential things that we were able to do on a local level. When we partner with our early learning partners, we are able to supplement and provide some extended wraparound services. So the local, the state, the federal, they have to work together. One is not in a vacuum by itself. The federal, they can't do everything for our programs and communities, but the majority that they give and leading by example truly sets the tone for state and local communities to then follow suit.
I would add to what LaTanya and Ann has shared. We've also been able to do many of the things that have been expressed, but I think also what this federal funding has done is really allow us to start looking at our systems in Alabama in a more comprehensive way. Having that strategic plan and pulling together around that strategic plan has made us have conversations that we were not necessarily having, since our DHR actually is over childcare. It's at a different agency, but now they are a part of our weekly conversations. In fact, I have a meeting this afternoon with their commissioner to just really talk about how can we help these funds to go further, because they are so limited and we cannot be duplicating efforts. We have to be having conversations. And I just have to say, since this PDG B-5 and starting this Birth to 5 steering committee, it's taken us down a path that we had not gone before in Alabama. And in fact, we now are over QRIS at the Department of Early Childhood. That was under DHR primarily, but because we were having those conversations, they saw the quality work that was happening in our pre-K program. They thought, why wouldn't we allow the education agency to actually be over quality in our childcare systems? So this federal funding made that possible for Alabama. And because of that, we are now not working in silos, but we're having those conversations about how we can do more of those things that will ultimately matter for children and families in our state in a more comprehensive way. So we absolutely need the funds. We also, as a result of this, had a transition committee when I started my position in July that allowed us to have conversations about how to better our system. Now we have recommendations from the Early Childhood Transition Committee that's also fueling our work. And as a result of that, we're pulling together a 3-meeting convening among all of Alabama's mayors to talk about what they can do locally to help better support early care and education. So it's an exciting time, but also a time to really gather together and have those conversations about how we can do this work more comprehensively across our state and across our nation.
You know, before the federal funding that we've recently received, you know, prior to the pandemic, there were so many structural flaws in the childcare system. Teachers make barely above minimum wage. Parents pay the largest expense, more than rent, out of their income for childcare. And all of these structural flaws made it so that the system could tip at any minute. You know, the centers have a dip in enrollment for 1 month and it can close their doors. Parents get behind on bills and that's it. They lose childcare and then they lose a job. And with the influx of federal funds, we're having the opportunity to look at the structure and say, this system is not set up to be successful. And it's so essential. If childcare falls, the economy falls. And we have to find a way to say, how do we support the system better? And with state funding, with minimal federal funding that we've had in the past, all we could do was just make it from month to month and help with subsidy and help with monitoring and help with background checks, but never have a look to say the system is not going to work long term. And when the closures began to happen at the beginning of the pandemic, and we realized how fragile the ecosystem was and how essential it was as the U.S. as a whole, it gave us the time to say, okay, we have to fix these fatal flaws or we're going to lose this. And it's not just, the education piece is essential for school readiness, but the social emotional piece we've realized this year is so essential. And the support to families. Somebody mentioned that the most personal decision you're going to make is where to leave your children. That's key, because parents don't go to work when they don't feel safe leaving their children somewhere. And when parents go to work, the economy can shut down just as easily. And we've seen so much of this year. We know that the ecosystem has to change. The infrastructure has to be redeveloped. And these boosts of funding are going to allow us to take a look at the infrastructure. I don't think it's enough to completely fix it, but it's giving us the opportunity for the first time to say, these are where the flaws are. Can we tweak it? Can we make some improvements so that we can make it more steady? Because we can't lose the childcare system.
Well, Dr. Vandenberg, that sets up our last question perfectly, which you sort of basically just answered, but the last question that we received around, after such an incredibly difficult year and seeing all of the challenges, particularly to our early learning care system, what are some of the most important takeaways from the challenges of the last year that can be applied for, long-term improvements to our nation's early learning and care system, which I think you just answered pretty well. But if you have any additional thoughts, or if others wanted to just share any thoughts on what are some of the biggest takeaways from the last year.
I think one of the biggest for Head Start truly was resilience. I mean, I know 56 years ago, 50 years ago, 2 years ago, 1 year ago, we did not think today is the 1 year anniversary of our COVID-19 implementation. So the resilience of our teachers and our families with technology, I think, was the biggest takeaway, that we had to teach teachers how to teach virtually, but we also had families who did not have access to technology and could not receive the virtual teaching. So I think if I had to say one, that's the biggest one, was just resiliency, and especially around technology, because Head Start virtually did everything.
I would agree. Resiliency was something that we learned this year. At the beginning of the pandemic, the beginning of the shutdowns, the National Association for the Education of Young Children did a survey nationwide of providers and said, how many of you can sustain a closure of more than 2 to 3 weeks? And 40% of childcare programs said they would close down. And I've been so amazed. In Kentucky, we've lost about 9%. Our childcare providers are tough. They are hanging on by the tips of their fingernails, trying to keep their businesses open because they love their kids. They're investing all they have to keep their programs open, and they're doing it and hanging on. But the other thing that we have to realize is that we have got to support them, that this kind of determination that they have to stay open is not going to last forever, because funding is a part of the solution, whether or not they are determined. And I think we have to support those men and women and come behind them to support the amazing job that they've been doing.
And I would just briefly add that the pandemic has also taught us to listen more and to not think that all of the answers lie necessarily with the state agency. We've been listening to parents, we've surveyed parents, We've had conversations with parents and parent groups to really learn about what their needs are and how we can make things even better as we look at ways we can build this system moving forward. Just hearing those multiple perspectives has also highlighted things such as mental health. I mean, that was already the #1 issue identified through our Children Policy Council surveys. So we've looked at some ways that we can better address the mental health needs in infant and early childhood, as well as just how do we take care of the professionals, because these are the ones who are going out and having those conversations with families and with the child care centers. We do a weekly Monday mindfulness minute with our team here at the state agency to just make sure that we're grounded and that we're pouring into ourselves so that we can go out and really support the profession. But I just think this has raised an awareness around things that we have to absolutely be addressing, particularly around the mental health of our childcare professionals and our families and young children.
And it's so interesting to me, and I appreciate the perspectives from everyone who joined us today about the reality that the past year has helped, I think, so many people understand the invaluable role of childcare and early learning, the programs, the providers, the incredible professionals who are part of the system, and you know, what that means for our economy as a whole and for our families, and the way in which bipartisan champions in Congress stepped up to ensure relief funding flowed is commendable. And I think immense debt of gratitude to folks who shared stories and then members of Congress who were able to act on it. But I think part of what motivated so many of us to step up this year is because we know that promise of childcare and early learning and what it can mean for children and for families and for communities. And that's not going to change, you know, as the pandemic ebbs and flows and as relief funding can help us plug immense gaps. And I think that's where we sort of step in each year and say investment in childcare and early learning is critical and needs to happen. And needs to happen on an ongoing basis. And I think the perspectives today really have illustrated why and what that money goes to.
Yes, and I just want to thank again all of our panelists for joining today for such a terrific discussion. We really appreciate you taking the time, as well as all the congressional staff that joined and took time out of a very busy committee work week on the Hill to listen to this discussion. We will certainly be following up with offices to provide additional information and highlight the various member-led appropriations letters. Again, we appreciate the ongoing bipartisan support for early learning and care. And thank you all again for taking time today.